In the wilderness, the margin for error is thin. Out here, there are no hospitals just down the road. No emergency vehicles racing through traffic, no flashing lights signaling that help is on its way. When an accident happens, the response begins with you. Wilderness first aid is the skill set and mindset that fills that critical gap, the time between injury and rescue. It's not only about knowing medical techniques. It's about learning how to think and act under pressure. When resources are limited and the environment itself becomes part of the problem, wilderness first aid begins with preparation. Before any expedition, it's essential to assess risk, pack appropriately, and understand the terrain and weather. Preparation is the first form of treatment. A well-thought-out plan reduces the likelihood of emergencies and improves the response when they occur. Each trip should begin with a medical plan. Who are you traveling with? What are their medical histories, allergies, and medications? Where is the nearest point of evacuation? How will you call for help if communication systems fail? Every member of a group entering a remote environment should know basic first aid, but wilderness first aid goes further. It teaches how to adapt those principles when medical support is hours or even days away. In these settings, you cannot rely on rapid evacuation. Your actions may determine whether a minor injury heals or becomes life-threatening. The first step in any emergency is scene safety. Before you approach a patient, you assess the environment. Are there falling rocks, unstable ground, fire hazards, or animals nearby? One rescuer becoming injured only adds to the problem. Once the area is safe, the next task is to take control of the situation. Speak clearly, stay calm, and identify yourself as the responder. Panic is contagious, but so is calmness. Next comes the primary assessment. This is the systematic process of identifying immediate threats to life. The steps are simple but crucial: airway, breathing, and circulation, often remembered as the ABCs. Ensure the airway is clear. Check if the person is breathing and if their heart is beating. In a wilderness setting, you may need to perform these checks without medical tools, relying only on observation and touch. If there is no breathing and no pulse, begin CPR. However, in remote areas, the decision to start or stop CPR must be made with realism. Prolonged resuscitation efforts are exhausting and often unsuccessful without medical backup. Wilderness first aid training teaches how to make those decisions based on time, environment, and available help. Once life-threatening issues are under control, the secondary assessment begins. This involves a head-to-toe examination, noting all injuries, deformities, or pain. Ask questions if the person is conscious. What happened? Where does it hurt? Do they feel dizzy, nauseous, or confused? These answers guide your next steps. If the patient is unconscious, look for clues, medication, allergy tags, or signs of trauma. Bleeding control is one of the most immediate and critical priorities. Severe bleeding can lead to shock within minutes. Direct pressure is the most effective way to stop bleeding. Use a clean dressing or any available cloth to press firmly on the wound. If blood soaks through, do not remove the dressing. Add another layer and continue pressure. Elevation and pressure bandages can assist, but only if they do not cause further injury. Tourniquets are a last resort in wilderness settings and should be used only when direct pressure fails to stop life-threatening bleeding, especially from limbs. Fractures and dislocations are common in wilderness activities. A simple misstep can lead to a broken bone or sprained joint. The golden rule is to immobilize, keep the injured area still and supported. Movement can worsen internal damage or increase pain. Improvised splints can be made from sticks, trekking poles, or even rolled up sleeping pads secured with cloth or tape. Always pad between the splint and the skin to prevent further injury. Assess circulation below the injury. The limb should remain warm and pink. If it becomes pale, cold, or numb, the splint may be too tight and should be adjusted immediately. Head injuries require particular attention. Even minor head trauma can lead to serious complications like concussion or internal bleeding. Look for signs such as confusion, vomiting, or loss of balance. If the person loses consciousness, even briefly, treat the situation as serious. Keep the patient still and avoid unnecessary movement. Monitor closely for changes in breathing or awareness. Spinal injuries are another major concern. In the wilderness, rough terrain increases the risk of falls and impacts that can injure the spine. If you suspect a spinal injury, such as after a fall, high-speed impact, or if the person reports numbness or paralysis, minimize movement as much as possible. Do not attempt to reposition the person unless there is immediate danger, such as fire or flooding. Manual stabilization, holding the head in a neutral position, is often the safest temporary measure until help arrives or evacuation is possible. Environmental conditions play a major role in wilderness emergencies. Hypothermia, heat exhaustion, and dehydration are among the most common and dangerous problems faced by outdoor travelers. Hypothermia occurs when the body loses heat faster than it can produce it. It can happen even in temperatures above freezing, especially when combined with wind, wet clothing, and fatigue. Early signs include shivering, slurred speech, and loss of coordination. As it progresses, shivering stops and the person becomes confused and lethargic, a sign of severe hypothermia. Treatment focuses on gentle rewarming. Move the person to shelter, remove wet clothing, and wrap them in dry insulation. Apply warmth to the torso, not the limbs, to prevent cold blood from returning to the core too quickly. Avoid rapid or rough handling, which can trigger cardiac arrest in severe cases. The opposite condition, heat-related illness, can strike during hot weather or heavy exertion. Heat exhaustion causes weakness, dizziness, and profuse sweating. If untreated, it can escalate to heat stroke, a life-threatening emergency where the body's cooling system fails. The person may stop sweating, appear flushed, and develop a rapid pulse or confusion. Immediate cooling is vital. Move them to shade, remove excess clothing, and apply cool water to the skin. Fanning can assist evaporation. If they can drink, provide small sips of water or an electrolyte solution. Rapid evacuation is necessary if consciousness decreases or vomiting prevents hydration. Dehydration often develops slowly. By the time symptoms like headache, fatigue, and dark urine appear, performance and decision-making are already impaired. Prevention is the best treatment. Drink regularly, even before feeling thirsty. In desert or high-altitude environments, fluid loss increases unnoticed through breathing and sweat. Monitoring urine color is a simple and reliable field method for assessing hydration. Another challenge in the wilderness is altitude illness. As elevation increases, oxygen levels decrease, affecting the body's ability to function. Early symptoms include headache, nausea, and difficulty sleeping. The most effective treatment is descent. Even a few hundred meters can make a difference. Supplemental oxygen, if available, can help, but rest and hydration are essential. Ignoring symptoms can lead to high-altitude pulmonary or cerebral edema, which are medical emergencies. Burns are another frequent injury, especially around campfires or stoves. First, stop the burning process. Remove the person from the source and cool the area with clean, cool water for at least 10 minutes. Avoid ice or direct cold packs, which can worsen tissue damage. Cover the burn with a clean, non-stick dressing. Do not apply creams or butter. For large or deep burns, treat for shock and seek evacuation. Burns on the face, hands, or genitals require urgent attention. Wounds in the wilderness carry a high risk of infection. Clean them thoroughly with safe, drinkable water or an antiseptic solution if available. Remove visible dirt and debris carefully. Cover the wound with a sterile dressing and keep it dry. Change the dressing daily or if it becomes wet. Signs of infection include redness, swelling, pus, and fever. If these develop, evacuation is recommended for antibiotics and further care. Shock is a condition where the body's circulation fails to deliver enough oxygen to tissues. It can result from blood loss, dehydration, or trauma. Symptoms include pale, cool skin, rapid pulse, and weakness. Treat the underlying cause, lay the person flat if possible, and elevate their legs slightly to improve blood flow. Keep them warm, calm, and reassured. Do not give food or drink if they might require surgery or have abdominal injuries. In remote situations, time becomes the most valuable resource. Every decision, whether to treat on site, move the patient, or call for rescue, depends on judgment. Evacuation planning is essential. Evaluate the patient's condition. Can they walk? Is their airway stable? Can bleeding be controlled? Can they survive the journey? If not, establish communication with rescue services using radios, satellite devices, or signal mirrors. Always record the details: the time of injury, treatments given, and the patient's response. This information is critical for rescuers. Beyond the physical injuries, wilderness first aid also involves psychological support. Fear, guilt, or panic can worsen any situation. The responder's demeanor sets the tone for everyone. Speak clearly, maintain eye contact, and offer reassurance. Keep patients informed about what you're doing and why. Simple empathy, listening, explaining, encouraging can stabilize emotions and reduce shock. Group management is another vital skill. In a team setting, assign roles. One person provides first aid, another secures shelter, and another monitors communication or navigation. Order and cooperation prevent chaos. Always account for everyone's safety: rescuers, bystanders, and the injured alike. Wilderness medicine extends beyond emergency response. Prevention remains the most effective form of care. Proper nutrition, hydration, clothing, and pacing can prevent most wilderness illnesses. Learn to recognize fatigue and adjust the group's pace. Regular rest, sunscreen use, and hand hygiene prevent small issues from escalating. Carry a well-stocked first aid kit, but remember that tools are only as useful as the knowledge behind them. The wilderness demands respect. It rewards preparation and punishes negligence. Every year, preventable accidents claim lives not because of a lack of equipment, but because of a lack of awareness. Wilderness first aid bridges that gap. It transforms ordinary travelers into capable responders, people who can make a difference when the unexpected happens. In the end, wilderness first aid is about responsibility to yourself, to your group, and to those who may depend on your actions. It's about staying calm under pressure, applying clear procedures, and thinking ahead. Every dressing, every splint, every decision carries weight. The environment will test not only your skills, but also your patience and judgment. Even in the most remote places, good first aid is built on simple principles: assess, stabilize, protect, and plan. Do not rush, do not guess. Use what you know, adapt what you have, and remember that most emergencies are won or lost in the first few minutes. When the helicopter finally arrives, or when you make it back to the trailhead, you'll realize that wilderness first aid is not about heroics. It's about quiet competence, knowing what to do, when to act, and how to stay composed. It's about extending the reach of medical care beyond the walls of hospitals, into the open spaces where help may never come unless you bring it with you. That is the essence of going beyond the basic bandage, the commitment to be ready, to think clearly, and to act with purpose when it matters most. Evacuation is one of the most difficult and critical decisions in wilderness first aid. In remote environments, every evacuation carries risk to the patient, to the rescuers, and to the entire group. The goal is always to move the injured person safely and efficiently without worsening their condition. Deciding whether to evacuate immediately or wait for help requires assessing several factors: the patient's stability, available resources, distance to safety, weather, and terrain. If the injury is minor, such as small cuts, sprains, or mild dehydration, treatment and rest on site may be enough. But if the patient shows signs of internal bleeding, altered consciousness, severe pain, or breathing problems, evacuation should begin as soon as possible. Time is the enemy in serious injuries, and delay can turn survivable situations into fatalities. When help cannot reach you directly, self-evacuation may be necessary. This involves preparing the patient for transport, securing the scene, and communicating with any available rescue service. Before moving the patient, ensure the spine and major joints are protected. If spinal injury is suspected, movement should be minimized. A makeshift stretcher can be constructed using materials like sleeping pads, trekking poles, or sturdy branches tied together with ropes or clothing. The stretcher should support the full length of the body and keep the patient stable. For walking evacuations, assess whether the patient can safely bear weight. Support them with trekking poles or an improvised crutch made from a branch. Move slowly and take frequent breaks. Remember, energy conservation is vital. Rescuers who become exhausted only create more risk. Communication in remote areas can mean the difference between life and death. Traditional cell service is unreliable in most wilderness regions. Modern responders rely on satellite messengers, emergency locator beacons, ELBS, or personal locator beacons, PLBs. These devices transmit a distress signal with GPS coordinates to rescue centers, allowing professional teams to locate you. Even with such devices, basic signaling knowledge remains essential. A mirror, whistle, or brightly colored cloth can attract attention from aircraft or distant searchers. The standard distress signal is 3 of any kind: 3 flashes, 3 shouts, or 3 whistles, repeated at intervals. When rescue teams approach, ensure the area is safe for landing or approach. Clear a visible zone if helicopters are expected. Keep the patient warm and secure while awaiting extraction. Document all treatments performed, times of injury, medications given, and changes in the patient's condition. Handing over a clear report helps rescuers continue appropriate care seamlessly. Now let's consider equipment. A wilderness first aid kit must be more comprehensive than a typical home kit, yet compact enough to carry. The exact contents depend on the environment and duration of the trip. Essential items include sterile gauze pads, adhesive tape, elastic bandages, antiseptic wipes, gloves, blister care materials, scissors, tweezers, and a CPR mask. Add medications such as pain relievers, antihistamines, and oral rehydration salts. For longer expeditions, consider antibiotics, burn gel, and splinting materials. But tools are only half the equation. Knowing how to use them is the true measure of preparedness. A lightweight kit is useless if you cannot apply a dressing or improvise when something runs out. Wilderness medicine training emphasizes adaptation, turning available items into effective tools. A clean shirt can become a bandage. A foam pad becomes a splint. A tarp and rope can form a makeshift litter. Even boiling water and soap can serve as an antiseptic in the absence of medical supplies. The focus is always on function, not form. When every ounce in your pack matters, knowledge replaces weight. Improvised shelters also play a role in wilderness medical response. Once an injury occurs, exposure to the elements becomes the next threat. A patient lying on cold, wet ground loses heat rapidly, worsening shock. Insulating them from the ground with sleeping pads, leaves, or extra clothing can prevent hypothermia. Tarps, ponchos, or even large garbage bags can create wind and rain protection. The priority is to stabilize both the patient and the environment around them. Wilderness emergencies test not only medical skill, but also leadership and communication. The first responder must maintain control even in chaos. Clear, concise communication prevents errors and confusion. Announce what you are doing before you do it. Assign specific tasks. One person gathers water, another keeps watch, and another tracks time. Structure keeps the group focused and reduces panic. Decision-making under stress is a defining aspect of wilderness medicine. With limited resources, every action has a trade-off. Using your last dressing for one wound may leave you without supplies for the next. Attempting to move an injured person too soon can cause more harm than good. The key is prioritization, treating the most life-threatening problems first while planning for long-term survival. Understanding the concept of the golden hour helps guide decisions. In urban settings, medical professionals emphasize the first hour after injury as the most critical for survival. In the wilderness, this window stretches longer, but the principle remains. The faster life-threatening issues are addressed, the greater the chances of recovery. Wilderness responders are trained to extend this golden hour through smart, efficient care, controlling bleeding, preventing infection, maintaining warmth, and conserving energy. In prolonged emergencies, patient monitoring becomes as important as initial treatment. Even after stabilization, conditions can deteriorate silently. Shock may develop hours later. Infections may begin to spread. Set regular intervals, every 15 or 30 minutes, to recheck vital signs, pulse, breathing rate, and mental status. Record these findings in a notebook or on tape. Patterns tell you whether the patient is improving or declining, helping you decide when evacuation becomes urgent. Nutrition and hydration are part of this extended care. If the patient can eat and drink safely, provide small, frequent sips of water and simple carbohydrates. Avoid alcohol or caffeine, which can worsen dehydration. In cold conditions, warm fluids provide both comfort and heat energy. In hot conditions, cool fluids help control body temperature. Pain management is another key component. Pain increases heart rate and stress, which can accelerate shock. Over-the-counter painkillers like ibuprofen or acetaminophen can help, but avoid excessive dosing. Non-medical pain relief, such as rest, elevation, or cold compresses, can be equally effective when resources are limited. Always observe for allergic reactions when administering medication in the field. In some situations, multiple patients may be injured at once, such as during a climbing accident, avalanche, or severe weather event. This requires triage, the process of prioritizing care based on severity and likelihood of survival. Triage is not about value judgments, it's about resource allocation. Focus on those who can benefit most from immediate treatment. Once the most critical are stabilized, move on to others. Wilderness first aid also teaches risk recognition. Many emergencies can be prevented simply by paying attention. Fatigue, hunger, and dehydration impair judgment and coordination. Many injuries occur not from inexperience but from overconfidence or haste. Regular breaks, hydration, and group check-ins keep small issues from becoming serious. Lighting, terrain, and weather all affect safety. Traveling late in the day increases the chance of slips and falls. Wet rocks, river crossings, or loose gravel are common causes of sprains and fractures. Learning to read terrain and plan routes conservatively is part of first aid in a broader sense. Prevention through decision-making. Psychological resilience is another essential skill often overlooked in wilderness medicine. Isolation, fatigue, and fear can degrade morale quickly. After an accident, people may experience guilt, anxiety, or helplessness. The responder must not only treat injuries but also manage emotions, their own and others. Speak in a calm, measured tone. Encourage teamwork. Focus the group on practical steps rather than uncertainty. These actions keep people mentally anchored in moments when the wilderness feels overwhelming. When death occurs in remote areas, which sometimes it does, the responsibility of the responder extends to the living. Preserving the dignity of the deceased, ensuring group safety, and coordinating recovery efforts are part of advanced wilderness leadership. Emotional resilience becomes as critical as technical skill. After the crisis passes and the evacuation is complete, post-incident reflection is essential. Review what happened, what was done well, and what could improve. This process of debriefing strengthens future readiness. Every emergency, no matter how small, becomes a lesson, a chance to refine judgment, organization, and technique. Training is never finished. Wilderness medicine evolves with experience and research. Courses in Wilderness First Aid, WFA, or Wilderness First Responder, WFR, certification provides structured, hands-on learning. These programs cover not just the physical skills but also the mental framework required for real-world application. Participants learn to simulate emergencies, improvise with limited tools, and communicate effectively under pressure. Instructors emphasize the principle of do no further harm. Every treatment, however well-intentioned, carries risk if performed incorrectly. Training and repetition build confidence and precision. The more familiar the procedures become, the more calmly and efficiently they can be applied in the field. Wilderness medicine also emphasizes adaptability across environments, from dense forests and snowy mountains to deserts and tropical jungles. Each setting introduces unique hazards: altitude, wildlife, water scarcity, or extreme temperature. Knowing how to adjust first aid practices for these variables is what separates a basic responder from a skilled one. In desert environments, water conservation and heat illness dominate. In cold regions, hypothermia and frostbite are constant threats. In jungles, infection and parasites require vigilance. Each condition requires not just medical knowledge but environmental awareness, understanding how terrain and climate interact with human health. Wildlife encounters pose another category of risk. Snake bites, insect stings, or animal attacks demand calm, precise responses. The goal is to limit toxin spread, reduce pain, and prepare for evacuation. Most snake bites, for example, do not involve venom injection, But immobilization of the affected limb and minimal movement are essential until professional care is available. Navigation also intertwines with wilderness medicine. Getting lost or disoriented can quickly become a medical emergency as exhaustion, dehydration, or panic sets in. Always carry maps, compasses, or GPS devices and know how to use them. When injuries occur, knowing your exact location accelerates rescue and prevents further harm from misdirection. The human factor remains constant across all wilderness emergencies: judgment. The best responders combine knowledge with composure. They follow structure but remain flexible. They plan, observe, act, and reassess again and again until the situation stabilizes. Wilderness first aid represents more than medical skill. It's a philosophy of self-reliance and responsibility. It teaches that survival depends not only on gear but on mindset, the ability to stay calm, think critically, and adapt continuously. Instructors often say, the wilderness doesn't forgive mistakes, but it rewards preparation. That's the essence of going beyond the basic bandage. It's the understanding that a splint or dressing is just one part of a much larger system: awareness, prevention, leadership, and decision-making under pressure. Every person who ventures into wild places carries an unspoken duty to be capable of helping others. The knowledge you bring into the wilderness is the most valuable item in your pack. Batteries die, maps tear, but skill and calmness endure. When you train for wilderness first aid, you train not just to respond, you train to think clearly when everything else falls apart. You train to keep someone alive until the storm clears, until rescue arrives, until hope returns. And when it's over, when the helicopter lands or you finally reach the trailhead, you understand that the true power of wilderness first aid lies in its simplicity, preparation, observation, and care. Those principles can turn ordinary people into lifesavers. So whether you're a hiker, a guide, or an adventurer, remember this: wilderness first aid is not just a skill to learn once, it's a mindset to carry always. Every trip begins with prevention, every injury begins with calm, and every rescue begins with someone who refuses to give up. That is what it means to go beyond the basic bandage, to stand ready, informed, and steady when the wilderness calls for help. Maybe the story doesn't end here, maybe it's just the beginning. Think about it, and I'll see you in the next video.